Well, thanks so much for watching Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by co-host Dr. Apoorv Gupta, and today we are so excited to welcome Dr. Gordon Chen, who is co-founder and CEO of ThriveWell. He is also part of the founding family and former chief medical officer at ChenMed and current board member of ChenMed. Thanks so much for being here.
Wonderful to be with you today. Yeah.
Gordon, thanks so much for being here. We are so excited to talk to you because you've done so many amazing things. I mean, your family really transformed the way that primary care was delivered through ChenMed, and then you got it to an amazing place. ChenMed is still doing fantastic things. You're still part of that. But you and your wife now co-founded ThriveWell, which has two different companies underneath it. So why don't you start by telling us, about the work that inspired ChenMed, and then what you and your wife are now hoping to continue through the ThriveWell journey.
Yes. Yeah. Thank you, Stephanie. My wife and I spent 20 years helping to really learn how to transform primary care through ChenMed. And I don't know if, I told you how we got started. It really started through a family crisis. My dad was diagnosed with cancer. We thought he would only have 2 months to live. And through that struggle, just understanding how broken the healthcare system was, how uncoordinated it was. And without us as a family leaning in so deeply, and quite frankly, by the grace of God, like my dad would not be here today because he ended up getting misdiagnosed. And through all of that struggle and complications and whatnot, we just thank God that he made it through. He's now cancer free, he's healthy, he's doing well. But through that whole process, we learned many people fall through the cracks and they may die early or get hospitalized unnecessarily. And so Jessica and I and our whole family, we built ChenMed with this concept to make it right for seniors and help them to live longer and live better. So we developed a certain expertise as we're growing and scaling into different communities. We knew that the knowledge was important for better health, but what's even more important, the behavior change. If you can have a trusting relationship between a clinician and a patient and align on goals and can help move the needle in terms of the behavior changes needed to improve your outcomes, well, then you get the results that you're aiming for. So we were able to, through our relationship outcomes based care, we're able to lower hospitalization rates 30 to 50%. And our data, we're very much data driven. We were showing early evidence that our patients were living 5 to 7 years longer than they would have otherwise. And for the most part, it's the blocking and the tackling. It's making sure they're eating the right things, they're taking the right medications and stopping the wrong medications. But Jessica and I always knew that we could go much further if we had the right opportunity to. So about a year ago, Jessica and I stepped out of our operating roles at ChenMed, and we had this beautiful opportunity to then, really do some soul searching, right? What do we want to do in this next phase of our life? What do we believe, just openly, like what do we believe God has for us? Like what do we feel called to do in this next phase of our life? And we really love this concept of helping people to live to their fullest potential, live as many years as they can live with health. And so we talk about this concept of health span. You hear it all over, all over the news. Like, how do we increase not just lifespan, but health span? And so we came up with this term called the ThriveYear, which is basically an additional year of health span attained through pursuing optimized health, wellness, and purpose. And if we can create communities that can produce more Thrive years for that community, what a blessing. How many more productive, joyful years can we get from that? So that's what we took as our inspiration to build ThriveWell, and in particular, Blue by ThriveWell, which stands for Bringing Longevity to You.
Wow, it's an incredible journey. I'm so glad, Gordon, that you kind of captured some of where it started from. and really gratified to actually hear that your dad did so well because of all of you leaning in. That's just amazing to hear that you folks could have that kind of impact, and we're hopefully able to replicate that impact for so many others. I have questions that came up to me all throughout the way, but maybe I'll start at the ending. When you talked about bringing this to a community, so how do you go about doing that? Because ultimately, healthcare, the way in which we pay for it, the way in which it gets rewarded, is usually at that individual interaction level. But it sounds like you're disrupting that quite considerably if you're trying to actually make a change at the community level. So maybe you can tell us a little bit about what that intervention for the community is intended to look like, and what's the business model around that?
Yeah. So we all know that healthcare is broken, right? And for many, many Americans, it's not adequate for what we're going for. Healthcare as it stands right now, it's a pass-fail system, meaning if you're failing in some avenue, then they'll step in and we'll, do testing, we'll put you on the right medications, whatnot. But if you're not failing, then you're quote unquote normal and no one does anything to the normal people. But normal does not mean optimal. And so what more and more people are wondering is, I don't just want to be in the not failing category. I want to thrive. I want to optimize my health to get back as many healthy years as I possibly can have. It's like the difference if you have someone who's just, occasionally running and exercising and whatnot, or an Olympic athlete that has the coaching, the systems, the data, the technology to get to their PR and break records, right? And so why not do that for our own health? So right now, quite frankly, health insurance doesn't cover the optimization. So people have to pay out of pocket. So they're searching for direct primary care or concierge medicine or executive health, or they're joining fancier and fancier gyms or whatnot. And so what we wanted to do was to figure out how we can, through a longevity medicine approach, a very proactive, cutting edge, personalized, and tailored health approach that is designed to optimize your health, combined with personalized fitness, nutrition, and community, and understanding that there's been so many advances in how we exercise and how we recover. So how do we put all of those pieces together and come up with a destination where you can, through physicians working together with personal trainers, with nutritionists, and building this longevity community, come up with a system where you can actually improve in multiple different coordinated ways that all drive towards better longevity. So what do I mean by that? A couple quick examples, okay? Think about your body mass index, right? Like in healthcare, we're still checking BMIs. We all know that there's very poor data coming from that. That's, again, for the masses in a pass-fail type of way of thinking, right? If we had the ability to measure our body composition, our body fat, our soft tissue muscle mass, then we could have targeted approaches and training programs to increase our muscle mass and decrease our fat in a measurable way. VO2 max is something that has gotten a lot of attention. Now, as a cardiologist, if I were to just simplify what VO2 max means, it's your oxygen exchange at maximal exertion. And when you measure that, it's essentially looking at your cardiovascular fitness. When you measure that, that single measure will predict how long you're going to live better than almost any other measure. If you can improve your VO2 max by 3 to 4 points, you can lower your risk of death by 20%, right? And so it's very, very important to understand what your VO2 max is, but not just understanding what it is, make the proper interventions to improve that. So those are just two examples: body composition testing, VO2 max testing, but then combining that with the cutting edge medicine. For example, optimizing your heart health, lowering your inflammation, looking at your genetics and your epigenetics, optimizing your gut health, looking at hormones in a whole new different way, right? A lot of this is advancing so quickly, the rest of normal healthcare hasn't caught on yet, right? So a lot of this is just not supported by health plans currently, because health plans are under a lot of pressure to cut costs, and they're looking at only things that have been around for 2 or 3 decades or whatnot, that they're willing to approve. They're not necessarily looking at the cutting edge.
Yeah, that's really fascinating, Gordon. And you laid out so many different things that can be done. Again, a whole range of questions that are coming up. Maybe I'll ask two of them, and you can answer them, subsequently. One is, what about the mental health aspects that I'm sure you're thinking about that also contribute to thriving, and what do you do in those areas? And then the second question is, what is the mechanism by which all of these different modalities are delivered? Is it like a super concierge type program? Is it a series of like team visits? So if you don't mind talking about those, that would be great.
When I think of mental health, that is just one aspect of a person's overall health. And so ThriveWell and Blue by ThriveWell will be based upon a foundation of what we call the 5 drivers of health and wellness. And I believe in a holistic approach. Rather than just narrowing in and looking at one aspect, let's look more broadly. So the 5 drivers of health and wellness are: number 1, personal; number 2, community; number 3, your physical; number 4, nutritional; and number 5, your spiritual. So personal, community, physical, nutritional, and spiritual. Now, if we're optimizing those 5 areas, then a lot of the other problems solve themselves, right? It takes care of themselves. And to just briefly double click, so obviously you can go in many different directions with each of these 5. So our approach at ThriveWell is to simplify and to say, if we can win in the top 3 areas in each of these 5, then that's the Pareto. That's where we want to focus our attention on. So the personal component, for example, if we can win with purpose, our priorities, and our plan. What is our plan? Like a life plan, like being intentional. But it starts with purpose, right? If you have that purpose, your priorities properly organized, and a plan, you're on the right track. If you're in a community that is engaging, encouraging, and empowering, that's a very different setup. That type of community will support longevity. From a physical standpoint, physically, if we're active and we're focused on 3 things: sleep, steps, and strength. Think about just all of those 3 things, by the way, will solve a large portion of mental health issues, right? Sleep, steps, and strength, just movement, proper recovery, whatnot. Nutrition, we simplified it into 3 things again. We call the MRS approach, named after my missus, Dr. Jessica Chen, my missus, right? So M stands for mostly plant-based. R is real whole foods, not processed foods, like real foods you can see, pronounce, understand, right? And then S is a behavioral component that's stopping before you're full. And lastly, just to close out, that spiritual component, mindfulness, meditation, and motivation, which brings you back to purpose. So if we're really hitting these 5 areas, then you're already solving a lot of the problems that lead to either mental health issues or stress or chronic disease, and you're getting as proactive as you can get.
That is fantastic. I have so many notes from all of these things. And I was just like, oh my gosh. I mean, going back, I have to go back 2 questions. Pass, fail. I love that you talked about it that way, because it is so clear. It's almost literally like life, death. Like that's the only 2 things. Like, okay, are you heading towards, is your life okay? Or are you heading towards death? And if you are, let's intervene. And I mean, that's terrible. Who wants to think of life as pass, fail? You don't want to just live in that like area, right? You want to live in the thriving. I was like, holy cow, I love that you said that. I love that you were talking about and simplifying this, and then all of your different ways within these 5 parts, because it is when you handle these 5 areas of life, it makes so much sense. And I just can't figure out, like you said, that health plans don't do anything, that they're always looking to cut costs. And I don't understand how they can't realize that wellness is the path. And so you successfully were able to make change through ChenMed. You're clearly making change now with these new companies that you're working on and helping people age better at home with purpose. So, how do you help people make that shift and realize that these are the things that are going to make the difference for your life? And then you said behavior change is such a big part of it. How do you get people to change their behavior, because it's so hard? How did they get past, maybe they're thinking, "Oh my gosh, I'm 67. How can I start doing this? How can I focus on a VO2 max now?" Or what the heck does VO2 max even mean? So how do you start to do that? Because the possibility exists and these people can live purposeful years, but you have to get the buy-in, almost the buy-in from healthcare, from providers to insurers to the people themselves.
Wonderful questions. If I were to kind of bring us back to our vision for ThriveWell, for every community that we're serving, our vision is to add 20,000 ThriveYears. And to add that, like, how are we going to add 20,000 ThriveYears? Well, it's gonna take a look at each individual that we can make an impact on and add 10 to 15 years. Now, 10 to 15 years additional to your health span, I think that is very meaningful. And I think if people know that there's a pathway to get that, I think that there's going to be a market for that. Now, if you're investing in your health, then you're also going to be more committed to make the changes. That's one thing. But what really has to happen is it needs to be easy for people to sustain in that system, in that program that you have. So we're building a beautiful 20,000 square foot facility. It's going to have state of the art fitness equipment, but then also spaces for, recovery as well, like cold plunge, sauna, infrared sauna. We're going to have an opportunity to look at people's VO2 maxes, body composition testing, and then have places where you can go for executive health as well, where you can have your full longevity medical assessments done, along with purpose coaching, executive physicals, and then coming up with that perfect plan that a nutritionist has weighed in on, a personal trainer has weighed in on, a longevity medicine physician has weighed in on, and all to come up with that plan, but not just to have the plan and hand it back to you to say, hey, we're going to continue to meet with you at least twice a month with a personal trainer and work you out, but then bring you back to your goals that will help you to maximize your health span. While we do this, we're trying to create community, right? So my wife and I, we're really thinking about that community component. How do we bring people together? We're going to have a cafe for healthy eating. And then we're going to have indoor pickleball courts. So this location in East Fort Lauderdale is going to be like our ground zero, right? This is where we're starting. This is where we would envision that people can come for a 6-hour experience and go through the full executive physical and longevity medical assessment to get started on their journey. Once they're started on their journey, we intend to see them often. That's why we're getting the state of the art of fitness equipment. The programs, everything that we're going to have there, it's not going to feel like any other fitness facility because it's all dedicated to longevity. So it's focused on folks that are 40 years and older and saying, hey, this is a different stage in our life now that we need to train with more intention. We need to recover with more intention, and we need more coaching and guidance. And this is one of the things that we, even at ChenMed, we had physicians with multiple years of training come, and we said, hey, even physicians that have been attendings for 20 years, they still need coaching and development. And then as soon as our physicians experienced that coaching and development, they got better and they were able to deliver better care. But what about for normal adults that want that additional coaching? You're not left on your own. We bring in the best fitness and personal trainers that can help coach you to optimize your strength and your fitness and ultimately impact your VO2 and then lower your body fat and improve your soft tissue muscle mass.
I love this approach. I genuinely want to get on a plane and go there now because it sounds super fun. And when you and I talked before a couple weeks ago, you said you might wonder why pickleball, and I said, no, 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 Gordon. I know exactly why you chose pickleball because scoring is like doing Sudoku. It is the hardest thing in the universe
Yeah,
to be
that's right.
active and then be scoring this thing. It's the hardest game, but it's seriously so much fun. And I love your focus on community through this. So with this, I'm sure there are a million studies that you could cite that tell us how community and focus on wellness help people stay healthy and improve health, and even when you're going through something hard. So is this a place that if somebody who has a chronic disease, diabetes, I would think would be prime for this, something that you could potentially reverse at Blue by ThriveWell? Are there other conditions like that? You said as a cardiologist, I'm sure that there's a vested interest in helping these people because you know that change is possible. So, how do people who might originally dismiss this idea as I'm already ill? Is that true? Are you just doomed? Or can you go somewhere like this and make these changes that you found in these 5 areas and truly then reverse some of the damage that's been done and still have those purposeful years?
So Stephanie, you hit it right on the nail, right? Like we can reverse disease. If you're a diabetic or you've had a heart attack or heart disease or heart failure, like we can optimize and we can reverse, but we need to make the investment. And so what happens now is if as soon as someone has one or two chronic diseases, they start seeing their typical physician or cardiologist. And in the normal healthcare ecosystem, there isn't a lot of space for behavior change or for reversing disease because it's more about like treating your current disease and titrating the medications. We want to take a completely different approach. If we can add the nutritional component, the physical component, the community component, the purpose, all of those things will motivate and encourage someone differently that all of a sudden they may not need to be taking all of that blood pressure medication. Making the diet changes may lower their insulin requirements, but it's uncomfortable for someone to do that without physician oversight. So that's what we want to provide as well in Blue, where hey, we can watch your medications and all of your sugars, your cholesterol, your blood pressure. We can watch all of that very carefully as you're increasing your physical activity, as you're engaging more in community and building up the optimal lifestyle approach to help you to get those 10 more years back, right? Those 10 Thrive years back. So we want to provide that solution for people. Like you're tired of taking all these pills. How do you start reversing it? Hey, come check out Blue by ThriveWell. We'll start that reversal process right away.
I just so much like I can see this, why Stephanie has gotten so passionate about this. It's just an incredible vision that you've laid out for what really. No, I hesitate to even say healthcare because it's well care, thriving care that you're kind of really painting a picture of. So I really appreciate everything you're laying out, and I agree with you that the science and the technology all has progressed to the point where we should be able to add ThriveYears to our lives, but we're just not delivering it in the way that you're describing. So I'm kind of completely in tune with that. My final question comes a little bit from a like sort of a 90-degree angle to that, not intended to be a challenge per se, but I'm more thinking about the access to this kind of service. Will it be potentially? It sounds like it'll have to be paid out of pocket. I'm not sure if insurance companies will be able to take it up, especially at the outset. I mean, that may be your vision for a few years out. Does it create a challenge for some people not to be able to then, access services like this? How are you thinking about truly making it available to as many people as, can benefit and are willing to participate in something like this?
So wonderful question. And before I answer that question, I just want to create a vision, right? When you think about maybe a longevity community, maybe you've heard about a blue zone community or like the only one in America was Loma Linda, right? And they're living to 89, 90 years old on average. And that's even without the latest and greatest in terms of longevity medicine. That's just community, purpose, faith, and eating well and staying active and all of those things that are covered in the 5 drivers of health and wellness, right? And so I firmly believe that it is within our reach to create a longevity community that commonly lives to over 100. I believe that that is in reach. And what we're passionate about doing is not only observing the longevity communities, but creating a longevity community, right? So anytime that you're doing something cutting edge and you're creating something that has never been done before, the focus needs to be on making that happen, getting that proof point, not worrying about covering the masses. Does that make sense? So you have to push the envelope in a tight community. And you're right, like for this to launch successfully, we're going to expect folks that have more means to invest in their health to participate early. So when you think about Elon Musk and Tesla, obviously has really changed the whole, automobile industry, right? And he didn't start with the Model 3. He started with, higher end Model S. And then once he had that proof of concept, then he pivoted and said, why not create an electric car that anyone can afford? But if he started there, he never would have got to where he is today. So you need to start with getting that proof of concept down. And this is what we're going to create here in East Fort Lauderdale, this longevity community based upon the 5 drivers of health and wellness, and then bringing the best of longevity medicine in an evidence-based fashion to consumers. And the speed of innovation right now in the longevity community, it's so rapid right now. And so consumers need physicians and scientists to come together and study this and filter out what works and what doesn't work and is in an efficient and effective way, and then bring it to the community. And that's what we intend to do. Like, we're partnering with researchers at University of Miami. We're starting to look at this, coming up with the right study protocols that will help us to really simplify the longevity approach. Now, it's not rocket science. It doesn't need to be. Even what Loma Linda has, and each of these blue zone communities, whatnot, it's not rocket science. It is available for us. We just need to organize it, package it in a way that allows people to really create these longevity communities. And we need to start reversing disease and being open to changing our lifestyle and changing behavior. Now, to change behavior, you can't just have a one-off approach. You need to have a very thoughtful multimodality approach that has different levels of accountability, right? Accountability from a clinician to a patient, that works, but not as well as adding to that, accountability with a personal trainer, accountability with peers, with your community. And what we find is peer-to-peer accountability and community accountability is outrageously powerful.
I love this. This is fantastic. Thank you so much for being here. I loved this conversation. And again, I really just want to go right now. I want to go. Hand me the pickleball racket. I'm in.
Yeah, we're happy to host you, and we would envision that we would have a lot of visitors from the north come visit Fort Lauderdale in the winter, get a longevity medical assessment, get optimized in a way that they can go back to wherever they are and continue the progress.
Incredible vision, Gordon. Thank you so much for sharing this with us.
Thank you, Perv. Thank you, Stephanie.
And thank you all for watching. We'll talk to you soon. Bye-bye.